And Mombasa County health workers have vowed to continue with their strike until the county government addresses their grievances. They are accusing the county government of withholding their pay for 5 months and failing to remit their statutory deductions running into millions of shillings.
This was the situation in Mombasa. Health workers ditching hospital facilities to demand for their pay and improved services. Kenya National Union of Nurses Mombasa Branch Secretary Peter Maroko said life had become unbearable for health workers who cannot access health services as the county withheld their pay for the last 5 months and failed to remit their statutory deductions, including NHIF, making it difficult to access health services. The furious health workers are accusing the county government of ignoring their plight.
It's a legal requirement for the employer. Once he deducts this money from our salaries, he should be able to pay to the institution that are required within 10 days. But the employer has clearly infringed on our rights since the month of June last year, when all these issues were raised. We've had a dispute that has been running and is active in the Labour Office, but they are unable to actually make any difference from our previous engagements. But it's the responsibility of this employer, constitutionally, to ensure that residents of Mombasa get services that they deserve.
At the same time, they are demanding provision of quality personal protective equipment.
We cannot determine risk allowance by virtue of the training one has. We want the government to actually look for a better way to assess on how risk allowance is going to be paid. Because majority of us, if you look at the number of people who are paid, if you compare across the cadres, is that we've lost so many nurses, we've lost so many clinical officers and even doctors. But now we want equality of payment of the risk allowance so that we are able to be appreciated for the risk we take ourselves. And we call upon the government, especially the Minister of Labour, to gazette COVID-19 as an occupational disease.
They are now calling for the implementation of a health constitutional commission with the mandate to address their issues on time.
Employment, salaries, deployment and transfers of health workers. If at all we are able to have a commission of this kind, then at least all these perennial strikes that we have been having for the last 8 years will come to an end. Because at least for a time we'll be able to address our issues centrally.
This comes as the National Nurses Union has called for industrial action which could see health services shut down across counties. Reporting for Channel 1 News from Mombasa County, I'm Michael Mondiga.